Nursing assessment involves collecting, validating, and clustering of data about health challenges of an individual and their health needs. It is the first step in the nursing process. Nursing assessment is used to identify current and future patient care needs and incorporates the recognition of normal versus abnormal body physiology. But even though we are now in a time when the method of assessment is more specific and organized, we cannot hide the fact that a lot of important people have influenced what nursing have today. Allow us to share to you some details on how nursing assessment have developed from the Nightingale era to the contemporary period. Florence Nightingale, also known as the Lady with the Lamp and the founder of modern nursing, has helped shape the nursing practice with her ideas and contributions during her times. Nursing assessment has already been noted during her period.
Good morning, ma'am. I am your nurse for today and I will do a physical examination. Is that okay with you, ma'am?
Yes.
Okay, let's get started. Can you feel any pain, ma'am?
No.
The use of physical assessment, although limited, has been an integral part since the time of Nightingale. Sight and touch were relied upon to assess patients.
So I've noticed that you have some bruises on your knees. So I'm here to help you to clean them next time you have them. I'm using cotton balls to clean your bruise and to remove the dirt. And the water that I've used is clean, so don't worry.
Nursing assessment are the core of nursing and all nursing actions are based on them. Nightingale made rounds at night with her lamp, talking to and assessing the condition of her patients, the reason why the soldiers nicknamed her the Lady with the Lamp. During her rounds, Nightingale talked to her patients, offering them empathy and compassion in their moment of despair.
Hi, Mom. How are you? Do you have any concerns about your health? May I ask, how are you feeling?
Nightingale also ministered to patients who were dying, bringing them comfort in their last hour.
Hello, sir. How's your day?
I'm okay.
How are you feeling for today, sir?
I'm good.
Are you in a good condition? So, sir, we need to eat more healthy foods and become physically active. And we need to monitor your blood sugar daily and be compliant for medications.
Yes, Mom.
Florence Nightingale is considered the founder of holistic nursing. Her health assessment goes beyond focusing solely on physical assessment, but also addresses emotional, mental, and spiritual health. Florence Nightingale theory involves nurses' initiative to configure environmental settings appropriate for the gradual restoration of patients'
Now
health.
I've asked you lots of questions, but so that I can further assess and give you the best diagnosis and intervention, allow me to collect some pertinent data about your status. Is that okay, ma'am? Yes. First question, does your room have pure air and not polluted?
Since my room has a big window, the air flows continuously from outside. So I can say that the air inside the room is pure and free from any pollution.
Okay, ma'am. Next question. Where do you usually get your water to drink on?
We usually get drinking water from the water source on the nearby town, or we also have fresh water coming from a water source on the mountains.
Okay, ma'am. Next, do you have some windows in your room?
Yes, as I have said earlier, we have a huge windows on our rooms.
Okay. We must also maintain the cleanliness of our drainage. Does your drainage is clean?
Since the water flows continuously, I can say that the water flow cleans the drainages on our place.
For the last question, ma'am, does your room is free from dust, dirt, mildew, and dampness?
we make sure that we regularly clean our room. So at least twice a week. So I can say that the room is free from any dust or dirt or dampness.
Okay, ma'am. Thank you for those answers. Let's see what are we going to do to improve your situation.
Nursing assessment has developed in today's era. Nursing assessment includes collection of subjective and objective data. It also includes physical assessment, validating and documenting of those data gathered.
Hi, good morning, ma'am. I'm Rufami Santos, and I will be your nurse for today, and I will be assisting you until the end of this procedure. So, ma'am, I will ask you a few questions. Is that okay with you?
Yes po.
Okay. Can you tell me your name?
I'm Alring T. Campbell.
Okay, Alrain T. Kiambao. How old are you, ma'am?
I'm 19 years old.
Okay, 19. And where do you live?
San Fernando po.
Okay. You are Ma'am Alring Kiambao, 19 years of age, and living in San Fernando. Am I right?
Yes po.
Okay. So, ma'am, can you tell me how do you feel right now?
Actually, these past few days, I don't feel well because I feel nauseated. I also vomit as well as liquid stools, and that makes me worried.
Okay, with that, how often you feel nauseated?
Every day.
Every day? And then how many times do you vomit?
Once a day.
Once a day. So, last, how many times do you poop?
2 to 3 times a day.
So is there any other signs or symptoms that you feel right now, ma'am?
None.
Okay, none. So with that, ma'am, I will just repeat. Okay, you feel nauseated every day, right?
Yes po.
Okay. You experience once a day vomit,
Yes po.
and then 2 to 3 times a day on stools.
Yes po.
Okay. So I will just notify you later on what the process and the laboratory test that should be done, and I will just send this to the doctor, and we'll also send you the time and the date when will you go here in the hospital.
After getting the subjective data, the nurse will now move on to collecting objective data where it includes physical examination.
So first, what I will do is to check your vital signs. I'd like to get your BP first, ma'am, or your blood pressure. This is to make sure that your vital signs are normal. Your blood pressure is 130/90, ma'am. Now, I'd also like to check your pulse rate. Your pulse rate is 86. And your respiratory rate is 24. Now, let me also check your temperature. Your temperature, ma'am, it's 38.6. So everything is normal except your temperature. It is elevated, which is 38.6. It is not within the normal range. Now, ma'am, I'd like to do some physical examination on your body parts. This is to make sure which are the normal conditions and the deviation. So, ma'am, you can lay here. What I will do, ma'am, is percussion and palpation to make sure on which body part is aching and let us know on which parts we will treat. This is also to help the medical professionals to diagnose their disease. So first, palpation. Please rate, ma'am. 0 for no pain, 5 for severe pain. Next is percussion. So for the last one, ma'am, I'll do an auscultation to hear some body fluids on your abdomen. Thank you for your cooperation, ma'am, and we'll get back to you po.
After collecting data, it is now time to validate and document the data collected. This is where we analyze and make informed nursing judgment or nursing diagnosis.
Now that I have all the information I need, let me document the data and formulate a good nursing care plan. Based on the findings, I think I can use hyperthermia, related to decrease of fluid intake as a nursing diagnosis.
Although we've seen a huge improvement on how nursing assessment has been done during the time of Florence Nightingale, we can say that her contribution have helped shape how we do our nursing assessment nowadays. That's it for today's video, and we hope that you learned something.